Well, this hospital offers really a complete service from managing the referrals through to us to a specialist, both paediatric and adult service, and then the care on the ward, particularly for the paediatric patients, is excellent. And then we've got all the operating theatre facilities and rehabilitation facilities. I met Will a few years ago when he presented with quite a long history of a problem with his knee. He was a very keen, very good rugby player, but following an initial injury, he then had quite a characteristic problem which we see over and over again, which was when he returned to play, he seemed to be tackled by the invisible player. So out of the blue, while stepping or twisting on the rugby field, he would just go down as his knee collapsed underneath him. And then often his knee would be sore for a few days, he'd do exercises, he'd maybe have some physiotherapy, and then be encouraged to return to his sport. And then a game or two later, bang, down he goes again, tackled by the invisible player. And in all my time looking after cruciate ligament injuries in children and young adults, I don't think I've ever heard a better description of the effect of that injury on that player's ability to play their sport.
You trust professionals, so we were going to our GP weekly, monthly, season in, season out for 2 years, 2.5 years, and we knew as parents that there was something not right, and we were getting told it was his growth plates that were moving and his other knee moved and there was nothing wrong, and we were imagining it to go home. So we went to A&E, they told us pretty much the same, and we felt like we were going mad a little bit because we knew that it wasn't right. It became a bit of a withstanding joke with other parents that Will's knee had gone again, and they were calling him Kit Kat, and he got a bit of name calling going on, and it was quite upsetting for Will. And we persisted, and we ended up going to see our chosen physio, and that then was a life change. It was a game changer for Will. They knew straight away then that there was something not right, and recommended that we come to see Nick.
We spent a lot of time taking an accurate history, and his description, his mother's description of how he would go down, tackled by this invisible player, was so characteristic of a cruciate ligament injury. And then, of course, we get to examine his knee in a relaxed environment, which we have here, and then it was clear that there was a problem on examining the cruciate ligament. We then need to confirm the diagnosis, and we do that by working with our radiology colleagues, by the MRI service that we have. For knees, it's often MRI scan to help us accurately diagnose knee injuries, and that confirmed a problem with his anterior cruciate ligament. William and his family decided to opt for the surgical approach, and I think, to be fair to William, he had proved to himself and his family that the rehabilitation approach wasn't working.
His bedside manner was fantastic with William. He was kind, he was patient, he was reassuring to me and to Will. And you had the surgery done, and I think that day he was out, up and walking. They gave us the ward nurse number, so that was quite reassuring. You feel like you're not in a hospital setting. It's more like home from home, really. It's a little bit more comfortable.
We follow the paediatric patients that have ACL reconstructions until they reach skeletal maturity, which means until their knee stops growing. That's because we want to make sure that the surgery we have hasn't affected the growing parts of the bone. That is very, very rare, but it's important to watch for it just in case, so that we can manage it if that does occur. So he was discharged when he'd reached skeletal maturity. That was 2 or 3 years after the surgery, and he'd got back to his competitive rugby.
Gave us closure. I remember the first game back he played, and he played a full game, and he came off and he cried, I cried, we were both stood at the pitch, everybody was cheering, and it was really, really emotional, and we just stood and cried in the rain for about 5 minutes, can you remember? And he'd done it, and he'd got over, and he'd not played 5 minutes, he'd done a full game, and his knee had been perfect, so I think it was flight or fight, he'd done it.